Hello everyone, I am Dr. Harshad Adhav and I am going to demonstrate video technique of percutaneous trigger finger release. As we all know, trigger finger is a common hand disorder encountered in OPD. In age group of 40 to 60, more common in women than in men and more common in diabetics, gout or RA. It is usually seen in farmers, industrial workers, musicians. Usually, patient comes with a painful clicking or snapping in flexion and extension of the finger. There is a stiffness of the finger usually in the morning or soreness or bump at the base of the finger and the thumb, and very rarely comes with a locked finger that cannot straighten. As we all know, trigger finger is a stenosing tenosynovitis caused by A1 pulley blocking tendon movement so that the flexor tendon cannot glide more easily through the tendon sheath. Treatment options are non-surgical and surgical treatment. Non-surgical treatment is in the form of night splints, anti-inflammatory medications, changing the activity and steroid injections. Surgically, it can be treated with open release of A1 pulley or percutaneous release. Advantages of open release are proper visualization of A1 pulley and tendon, less chances of tendon lacerations and neurovascular injury, and less chances of recurrence. Disadvantages are it needs daycare admission in most of the patients, it needs general or regional anesthesia, which involves the cost of the treatment, which is more than percutaneous release. There are chances of infection and recovery time is delayed. Advantages of percutaneous release are it is a 5 minutes procedure, it does not need hospitalization, the cost of treatment is very less, there are no chances of infection and the recovery time is very less. The disadvantages are it is a blind procedure, hence no proper visualization of A1 pulley and tendon, so there are chances of tendon lacerations and neurovascular injury. The chances of incomplete release and recurrences are there, and there is a learning curve. Single most important point of surgical anatomy is proximity of digital neurovascular bundle, which is 1 centimeter away from center of A1 pulley. So if you stay in the center of A1 pulley during percutaneous release, there are very less chances that you would injure digital neurovascular bundle. The case I am demonstrating is 50 years male industry worker suffering from triggering of little finger right dominant hand, hampering his daily activities due to pain and locking. The case I am demonstrating is a 50 years male having right hand little finger triggering and it is painful. Hand is then cleaned with Savlon and painted with betadine solution. Flexor tendon nodule is then palpated and 2% plain xylocaine is injected around the nodule. I use bevel tip of 20 number needle to cut the A1 pulley. While the finger is flexed and locked, with another finger, nodule of the flexor tendon is palpated and needle is then introduced till the resistance of the A1 pulley is felt. Location of the needle is then confirmed with flexion and extension of the finger. If needle moves with flexion and extension, that means it is inside the tendon. Hence, it is slightly withdrawn till it stops moving with the flexion and extension of the finger. Bevel tip of the needle is then used to cut the A1 pulley by moving the needle from distal to proximal. While cutting the A1 pulley with the needle, the crepitus is felt and crackling sound is heard. With few to and fro movements, the A1 pulley is released and cut completely. While doing this, make sure that you are in the center of the pulley to avoid injury to digital neurovascular bundle. Complete release of A1 pulley is confirmed by active flexion and extension of the fingers. This is the same patient who had left hand ring finger triggering and it was released percutaneously 2 years back, and since 2 years he had no complaints. किती 2 वर्ष झाले आता? 2 वर्ष झाले. असाच अटकायचा आपण
बिलकुल असाच अटकायचा.
वाकवा सरळ करा. त्याच्यानंतर काही त्रास झाला हे केल्यानंतर
काहीच नाही.
परत अटकतोय एकदम स्मूथ आहे ना. आता अटकलाच नाही नंतर. Small dressing is given for 1 to 2 hours and the patient is asked to wash his hands immediately after 2 hours, and also the patient is asked for finger range of movement exercises for at least 1 month to avoid adhesions and all his routine work can be started immediately. Thank you.